Now, in a study published in journal Science recently, researchers have claimed that coronavirus super spreaders were behind the explosion of COVID in India. A group of patients that included about 8% of India's confirmed cases later led to almost two-thirds of its total infections. The research, based on tracing more than 3 million contacts in Andhra Pradesh and Tamil Nadu through August 1st, is the first major such study of transmission in a developing country. In contrast with the super spreader minority, 71% of confirmed cases whose contacts were traced weren't found to have spread the virus to anyone. Well, to talk more about this study, we're now joined by Dr. Ramanan Lakshminarayan, Director of Center for Disease Dynamics, Economics and Policy, who wrote the study. Thank you so much for joining us, Doctor. Give us more details about this study, especially this aspect of the super spreaders.
So this is the largest contact tracing study done not just in a developing country, but really in any country at all. I think, so basically we had data on about 85,000 primary cases and about 575,000 contacts of these cases, all of whom were tested for COVID. It was an enormous exercise involving tens of thousands of contact tracers and healthcare workers in the states of Andhra Pradesh and Tamil Nadu. And this covered the period from March, the beginning of the epidemic, through to August, so quite a long period of time. And the super spreader phenomenon, which we observed, is not just a function of individuals. So super spreading is both people, some people are more likely to shed virus, but it's also a function of, them being in a situation where they will spread to many people, whether it's in a crowded market or whether it's in a cinema hall or wherever else it might be. And we certainly did find that something like 8% of the primary infected cases were responsible for 60% of the secondary cases, which actually mirrors the kind of super spreading phenomena we've observed in other countries, but at a much smaller scale because the data have simply not been available. We just had a much larger data set, and I think this certainly gives a lot of weight to the idea that most people don't actually spread COVID.
Right. That has been a very interesting aspect of this study. How difficult was it? Because, you traced each person's contacts. So you had, 80 contacts per confirmed case being traced. Just tell us a bit more about how you did this.
So there were about median of 8 contacts per case. Some people had as many as 70 or 80 contacts traced. Some had, only 1 or 2. The study was actually conducted in the context of regular contact tracing by the states of Tamil Nadu and Andhra Pradesh. It was not done separately. So this is how these two states, which had built up the apparatus for doing this in the context of HIV/AIDS and other communicable diseases, this is how they really took on COVID. And it was enormously successful because it was able to keep a lid on the epidemic, particularly during the early period of time. Now, obviously, the disease has spread much further now. But it really required, a lot of what is just called regular, Shula, the epidemiology, someone picking up the phone and talking to someone who's positive to find out who they came in contact with. And remember, these contacts are high-risk contacts, not just someone just, talked to. These were people that either they shared linen with, or they hugged them, or they came in to live with them, or lived in very close contact with them. And we found also huge differences in the risk of getting COVID, depending on the nature of the contact. So, for instance, living with someone with COVID was a 1 in 10 chance of getting that disease from them.
Really?
If one were to travel with that person for 6 hours or longer, that was an 80% chance of getting the disease from them. If you were simply just, meet them in the community or outside, then the risk of getting COVID from them was about 2.6%.
All right. Another very interesting aspect of this study has been the bit about children. And this is really worrying, going forward with schools reopening in India. You found that children under 14 were found to be frequent silent spreaders of COVID.
So I want to clarify this. We did find that children are effective transmitters of COVID. They were not responsible for the bulk of the transmission. The bulk of the transmission was by adults between the ages of 20 and 50, because that is the age group that is going out for work or going to the market or whatever else it is. But the children result is important because there has been a bit of a debate globally on the research to try to understand if children are transmitters of COVID at all, whether they get infected, whether they can pass it on to other people. And what we found was, yes, they are effective transmitters of COVID. It does not mean that they are responsible for the bulk of COVID transmission, but they are important in the chain.
But even the fact that they can, because here in India, with schools reopening, we have joint families, we have elderly parents, grandparents even living at home. So this is something that, people are going to consider when they have the option of sending their child back to school. And already in the West, we've seen with schools reopening, cases of COVID do spread there.
Absolutely. So Israel is one example of a country which opened up the schools. They had a lot of cases increasing and they've had to shut down the entire economy. They've gone in for a second lockdown. I think that any attempt to reopen schools should be calibrated, should be accompanied by testing and done in a careful way. I think that's the main finding of the study, that you really should not assume that opening schools will have no impact on the disease. In fact, to the contrary. But I think this can be managed if done with frequent testing and with surveillance. And perhaps by having children study outside or not be in closed classrooms, particularly, air-conditioned classrooms would make a very ideal situation for transmission. So whatever can be done to have distancing, staggered school openings, etc., that would be desirable.
All right. Well, Dr. Lakshminarayan, thank you so much for speaking to us here at NDTV about this study.